Yeah.
You filming? Mm-hmm. Okay. All right, so what we're going to do here, on Melissa, is we're going to do a augmentation of temples with this new technique that we've developed. And basically what we're doing is, I'm going to turn your head just a little bit to the right here, or left, Melissa. What we're going to do is, first of all, we're going to mark out the temple. And the first thing you want to do is try and palpate the temple ridge, okay? And basically what I do is I kind of draw out where I want to augment the temple, okay? And this is kind of what I'm looking at doing. Now, the zygomatic arch is here, and you want to try and avoid getting too deep into your injections down towards the zygomatic arch, because with that comes an issue of where you can get into the middle temporal veins, and you don't want to do that. The important area when you're injecting the temple is to go 1 centimeter up on this ridge, and then go 1 centimeter parallel to the brow. And what that'll do is that will actually help to give a little bit of fullness in this area right here, which will then allow the posture of the tail of the brow to be more aesthetically pleasing by not only raising it, but also bringing it more forward, kind of kicking it out a little bit more. Now, one thing you want to do is you want to identify blood vessels. So when I go like this, you can see that there's a fair number of blood vessels. These are part of the sentinel blood vessels here, and you want to make sure that those are avoided, okay? So that's the drawing on that side. What I'm going to do is I'm going to come over here, and I'm going to do a drawing on this side. Once again, we're going to palpate the ridge, and come in like so, and kind of draw this out just like we said before. And we're going to go up a centimeter, and we're going to go parallel to the brow a centimeter. So probably right about in this region here. Okay. Now I like to do this with a cannula. So what I'm going to do is we're going to use velour here as the filler, and what I'm going to do is I'm going to lay the cannula against Melissa and clock it, so I know where I want the entrance of the cannula to be. So what I'm going to do is we're going to once again stretch the skin, make sure that we're in a situation where we're not going to be getting into any vessels. And what I'm going to do is I'm just going to do a little bit of an injection, just like that. Okay? And you can see that when you have bright light on the subject and you stretch the skin, you're able to prevent any entrance into the blood vessel there. So what we did is we just made a little entrance site. Okay? Now, the next thing we're going to do is we're going to now, this is a 27 gauge, 1.5 inch cannula, and what you need to do is we need to use a 25 inch or 25 gauge trocar. So what we're going to do here is we're going to just go right into this area, just very, very gently. But when you enter, you want to enter at about 15 degrees to the horizontal. And the reason why you want to do that is because you want this needle to start to skirt just right on the temporalis fascia. You can actually feel right when you're bucking up right against the fascia here, and that's where you want to stay for this technique. This is what will allow this to work effectively and very, very safely. There have been some reported cases of blindness in the literature from injection of temples, and this is one of the reasons why we came up with this technique, because I thought it was a really good idea for treating temples. Now, another thing you want to do is try and see if you can identify early on the anterior branch of the superficial temporal artery. And in Melissa, it is probably right about here. So that's something that is actually helpful to be able to identify it. I can actually palpate it right here, right now, so I know where it is. So what I'm going to do is I'm going to actually come out, and sometimes a little every once in a while you might just get a little drop. And then we're going to come over here, and what we're going to do is we're going to allow this to start working. And once again, that's right about where I'm starting to get into get onto the deep temporalis fascia. Now, I think it's really important that before we start this, I want to describe to you the layers of what the temple is made of. Okay, so the first is skin. Okay, below the skin is the subcutaneous tissue, and in the subcutaneous tissue is running the vessels, the sentinel veins, and the anterior branch of the superficial temporal artery. Okay, the next layer is the temporoparietal fascia. The temporoparietal fascia is where the frontal branch of the facial nerve comes in. Okay, and this is what innervates, obviously, the frontalis muscle. Below the temporoparietal fascia is a potential space that during a facelift you can just get right on it. Anybody that's done a facelift can get right on the deep temporalis fascia by just using the back end of the knife handle. Then the next layer is the deep temporalis fascia, and then after that is the temporalis muscle. Now, once you go through the temporalis muscle, you're then in the temporal fossa, which is a depression in the skull, and you have your supraperiosteal lining that's below the temporalis muscle. So this is the layers that you're going through. So what I want to do is, and my assistant here might help me a little bit, what I try to do is I try to really make this as taut as possible. Okay? And what I'm going to do is, right now, I'm exactly where I need to be. I feel the cannula skirting on the temporalis fascia, and I'm right where I need to be. Sometimes you get a little whispers of hair here. And then now what I'm going to start doing is I'm going to start injecting. And you can actually see right where the white dot was, where I'm able to inject. And as you can see, I'm being very taut here, and I am just gently placing filler in here. And you can see how easy this is going without really... Are you feeling much discomfort, Melissa?
Not at all.
Not at all. So, the fact that Melissa is not feeling any discomfort whatsoever is an excellent sign that we are right on the plane of where we should be. Because if she was feeling pain, we would know that we were in the wrong area. But I think the fact that this is being done in a very comfortable fashion is a great way of confirming that we're where we need to be. Still okay?
Mm-hmm.
Good. Okay. Now, believe it or not, that is the end of the procedure. And I just want to show you something here. What you can see is that, number one, you have absolutely no bruising whatsoever. Okay? Number two, you can see that there is no evidence of any encroachment of blood vessels or anything of that nature. And what we're going to do is, Melissa knows her face better than anybody. She looks at her face in the mirror every day. And what we're going to do is we're going to see if she can see the difference in terms of what we were able to do. But I think this is just really a really good example of what kind of result we can get. And once again, there's very little, if any, bruising whatsoever. So take a look at that, Melissa, and tell me if you see a difference. And yeah, thanks. Good. And see if you see what we were able to do.
Yeah, no, I do see it. Yeah.
Do you see how that you're here? You're smoother,
Mm-hmm. Yeah.
and your brow has a little bit of a better posture here, whereas over in here you're depressed.
Mm-hmm.
And
Yeah.
if you look straight on, you can see that if you follow this brow out, it presents itself a little bit better, whereas here you're kind of cutting back, and you can see that you're very concave. Do you see the difference?
I do.
So the other thing you can do too, that's helpful, is if we go like this, if we take a Q-tip and we go like this, sometimes we can see the hollowness that occurs, okay?
Mhm. Oh,
like
yeah.
that. Now, watch what happens when I come over here, where we just did it, and you can see you're nice and smooth.
Oh,
and,
yeah.
and you can see that you've got a nice line there, so.
Yeah.
What did you think?
I like it.
Yep. The nice thing about it too, on a scale of 1 to 10, with 1 being minor discomfort and 10 being the most excruciating thing you ever experienced.
A 1.
A 1 at most. There you go. And that was without any kind of anesthetic in that area.
Mm-hmm. Oh yeah.
So this is Laura.
Mm-hmm. Good. How much was it on this side?
I gave you 1 cc.
Oh.
Yeah, I was going to give you a half, but I think the 1 cc was better.
Mm-hmm.
It definitely gave a better look.
Mm-hmm.
Take a look. Do you feel that a little bit?
Mm-hmm.
So you can just go a little deeper on there. Pull a little harder with that. Relax a little bit. How about that?
That's
Better?
better.
Yeah. Okay, sorry about that.
That's okay.
So that was actually a good thing for you to see. I'm sorry that you had the experience of that, but that kind of tells you that when you're in the right plane, there is not any discomfort really whatsoever. Where you start getting into discomfort is when you start getting into, feel that much at all.
Mm-mm.
So, I mean, the technique is actually a relatively painless procedure. Once we get in the right line and get into the area where we really want this to fill in and take, do what we're trying to accomplish. Okay. Once again, you can see that there's not any bruising or swelling whatsoever. Can I please have a moist 4x4 glass? And what I like about this technique is that several things. Number one, it's clean. You can see the results right away. And the other thing is too, is I think that the placement of the product is in an area where I think there's going to be greater efficiency in terms of you'll need less product to accomplish what you're trying to do. You can imagine if you're trying to inject the temple region and you have to go through all those layers that we mentioned, and you have to go through the deep temporalis fascia, which is a really, really taut fascia, you're actually creating a scenario where you're going to have to use a lot of product in order to accomplish what you're trying to do. Okay, here. You can check that out.